Even after a vaccine is hopefully found and developed, coronavirus may have lasting implications for the way that we live our lives in the future. The decisions that governments are currently making around the world in their efforts to curtail the spread of COVID-19 will shape our healthcare systems, economy, politics, and culture. In order to stop the spread of the virus, or at least flatten the curve so our health systems can cope, we are all required to obey government direction in a way that we have never had to do before. In certain countries, those who do not obey the rules are punished accordingly. Technology has made it possible for us to be under surveillance a great deal of the time, particularly in large cities, where the virus is also able to spread faster. China was able to deploy technology in its fight against the virus. Citizens' smartphones were monitored, hundreds of millions of face recognition cameras were activated. People were requested to take their temperatures, monitor their body condition, and send the results back to the authorities. All this was used to detect and monitor coronavirus sufferers. A range of mobile apps then also warn citizens if they come into the proximity of an infected person. In Israel, similar methods have also been used. Prime Minister Benjamin Netanyahu authorized the Israel Security Agency to deploy surveillance normally reserved for terrorists to track coronavirus patients. When his parliamentary subcommittee refused to authorize the measure, he got it passed anyway with an emergency decree. Measures such as these may lead to the normalization of mass surveillance tools, to the point where we accept them and learn to live with them long after the threat of COVID-19 passes. When we unlock our phones and devices with the touch of a finger, will we also be handing over personal information such as our body temperature and blood pressure? With this data to hand, it would in theory be possible for government authorities around the world to stop the spread of any future viruses fairly quickly. Meaning, of course, that in our battle for increased privacy, the coronavirus could be the tipping point, moving the argument in the opposite direction. Given the choice between privacy and health, most of us would, of course, choose health. Working from home and online learning are other areas that could become more normalized in the future, as coronavirus forces us to look at ways in which these activities can be improved. Many more of us will start to treat online grocery shopping as the norm, as we have no option but to try it and then get used to it. Social contact will be reduced and the virtual world could become more prevalent. And finally, the customary business handshake also deserves a mention here and may soon be confined to history, as we instead learn to greet each other with a cursory nod.